All right, let's get right into it. In the world of emergency medicine, you get used to the body screaming for help in a pretty predictable way. But what we're talking about today is a condition that kind of whispers. It's a clinical puzzle that just flips the script on everything you'd expect to see when a patient is in shock.
So, picture this. You've got a patient whose blood pressure is tanking. It's dangerously low. That's a classic sign of shock, right? Your brain is already screaming tachycardia. You're expecting that heart rate to be through the roof as the body desperately tries to compensate. But then you look at the monitor, and the heart rate is slow. Maybe it's even dropping. What is going on? How is that even possible? Well, there's a name for this culprit, for this strange collection of signs. It's called neurogenic shock. And the reason it behaves so bizarrely is because the body's entire emergency response system, its alarm system, has been, well, literally unplugged. Okay, so what are we actually talking about here? Neurogenic shock is what we call a distributive shock. Now, that might sound complicated, but it's pretty simple. It's not that you're losing blood. The problem is with the pipes, your blood vessels. They've just gone wide open and floppy. And that's happening because the electrical wiring for your whole fight or flight system, it's been severed.
So, what could possibly cut those wires? Well, the number one cause, the big one, is a really severe spinal cord injury. And not just any injury. It has to be high up, above what we call the T6 vertebra. You can think of that spot as the absolute command center for controlling your heart and your blood vessels. An injury there, yeah, just pulls the plug on the whole system.
This is where it gets really fascinating. Our bodies have these two competing systems, right? You've got the sympathetic system, that's your go, fight or flight response. It makes your heart pound, it clamps down your blood vessels. But when that system gets knocked offline, the other one, the parasympathetic system, the chill out and relax network, is suddenly left completely in charge. There's no one to fight it. And what's the result? A slow heart rate, and those blood vessels just go wide open. The body's foot is basically slammed on the brake, with no gas pedal in sight.
Okay, so this lack of an internal battle, it leaves behind a really specific trail of clues. Let's follow that trail and see what we find. All right, here are the big tells. First, you've got bradycardia. That's the slow heart rate we've been talking about. Then you have hypotension, the super low blood pressure, which makes sense because the vessels are so wide open. But here's the really unique clue, the one that should make a light bulb go off. The skin below the level of the injury is warm and dry. Now, why warm? Because all that blood is just hanging out in those dilated vessels right under the skin. And why dry? Because the system that makes you sweat in a panic, that's offline too. And, spotting these signs isn't just an academic exercise. It's absolutely life-saving because this type of shock it's a different beast entirely. Let's really hammer down that critical difference. This right here, this is the single most important difference. If you remember one thing, remember this. In pretty much every other kind of shock, I'm talking blood loss, sepsis, a heart attack, the body's go-to move is tachycardia. The heart races, trying desperately to compensate. But neurogenic shock, it's the one glaring exception. The heart rate drops. Why? Because the system that screams speed up is completely broken. So why do we care so much about this one little difference? Because it totally changes how you treat the patient. Look, you can pump them full of fluids, but that's like trying to fill a leaky swimming pool with a garden hose. The problem isn't the amount of fluid, it's the size of the container. The real fix is using vasopressors. These are drugs that basically tell the blood vessels, hey, squeeze tight again. And obviously all of this is happening while you're making sure that spine and airway are 100% protected.
Okay, so let's put all the pieces together. Being able to spot this pattern, especially when things are chaotic, is a total game changer.
If you're going to burn one thing into your brain from this, let it be this simple equation. You see low blood pressure, you add in a slow heart rate, and then you see that warm skin, particularly if you suspect a spinal injury. Your brain should immediately be screaming neurogenic shock. It's a pattern that once you see it, you'll never forget.
And listen, this isn't just trivia for a medical exam. It's because this condition behaves so completely differently from anything else, from hemorrhagic, septic, or cardiogenic shock, that catching it early is everything. Getting it wrong means you could be giving the completely wrong treatment, and that's a huge deal.
So I want to leave you with this one last thought. In the chaos of a trauma, we're hardwired to look for the signs of a body fighting for its life, right? The racing heart, the cold, clammy skin. But the great paradox here, the thing that makes neurogenic shock so tricky, is that the biggest clue is the absence of that fight.
So the real question for you is, in the middle of all that noise and pressure, would you be able to spot the one body that's not fighting back?